This video is providing general information to you. Please keep in mind that your doctor may tell you something that conflicts with what you are hearing here. Always follow your surgeon's instructions. Before your surgery, you are required to see your primary doctor. If you have a cardiologist, you may need to see them as well, based on your primary doctor's recommendation. These doctors need to make sure you are medically optimized for surgery. They will also talk to you about any medications you should temporarily stop before your surgery. It is important that both your primary doctor and surgeon agree on what medications you should take before and after surgery. The most common medications that are of concern are any blood thinners or cardiac medications. Please make sure that your doctors know if you take any flaxseed, fish oil, or vitamin E tablets. These can also increase bleeding and should be stopped before surgery. You will need to have your nose swabbed prior to surgery. This will take place in our pre-admission testing center here at St. Vincent's Medical Center. The lab will be checking for staph, a certain type of bacteria. If you test positive, we then have time to provide you with medication prior to surgery. Your doctor will inform you of your results. Good nutrition is important before surgery. This will help make sure you have the strength post-surgery for rehabilitation. Eating healthy, well-balanced meals include iron-rich foods such as meat, fish, poultry, or whole grain foods, vitamin C to help absorb iron, and raw fruits, vegetables, and beans to make up your high-fiber foods. You should stop drinking any alcoholic beverages 1 week prior to surgery. This will help prevent excess bleeding. Please inform your healthcare team of your drinking history, because serious harm can result from alcohol withdrawal when not properly managed. Ideally, you should stop smoking at least 1 month before your surgery. Nicotine hinders the healing process and increases your risk of infection. St. Vincent's Medical Center offers resources to help quit smoking. Please feel free to reach out to your doctor or orthopedic navigator for additional information. If you need dental work, have it done at least 2 weeks before your surgery. After joint replacement, your surgeon may want you to take antibiotics before any future dental work. Please inform all of your doctors about your joint replacement. Maintaining good health and treating any infections is important for the health of your new joint. In order to prepare your home, you should temporarily remove any throw rugs. This is a fall risk while you are using a rolling walker. Please make sure you have a clear pathway throughout the house to avoid tripping or falling. You may not feel up to cooking, therefore we recommend you have some meals prepared ahead of time. Move items that are stored out of easy reach to counter height. If you have pets, make sure you have someone that is able to assist you with their care. Also, if you are recovering from posterior hip replacement, you will temporarily not be able to bend at the waist to clean up animal waste. For infection prevention, enlist some help in giving your home a thorough cleaning before surgery. The afternoon before your surgery, you will receive a call from hospital staff informing of your time of arrival. If you are having surgery on a Monday, they will call you on the Friday before that. It is important to drink plenty of fluids before and after your surgery. Eat and drink normally the day before surgery, however, do not eat after midnight. Drink 16 ounces of Gatorade the morning of surgery before leaving your house and heading to the hospital. Drinking Gatorade is important to give you nutrients that help with your surgery. If you are a diabetic, please drink 16 ounces of Gatorade Zero, G2 by Gatorade, or water. If you are required to take medication the morning of your surgery, please do so before leaving the house. Prior to surgery, you will need to prep your surgical site. You will be given a bottle of chlorhexidine soap, also known as Hibiclens or Dynahex, and instructions on how to use it during your pre-admission testing appointment. Please shower with this soap for 3 days total, including the day of surgery. For example, if your surgery is on Wednesday, then you will shower with this soap on Monday, Tuesday, and Wednesday. Please contact your doctor or orthopedic navigator with questions. Do not shave any closer than 3 days before your surgery, as you may accidentally nick yourself. Wear clean clothes every day as your incision heals. Put on fresh pajamas every night. Place clean sheets on your bed, and shut your bedroom door so that no animals lay on your bed. Don't forget to use a clean towel after each shower to avoid an infection at your surgical site. The morning of your surgery, it is likely you will be nervous or anxious. This is normal. Therefore, it is a good idea to pack for the hospital ahead of time. You should also keep a list of any last-minute questions. It is easy to forget something you wanted to ask once you enter the hospital. When packing your bags, it is important to bring certain items. If you have sleep apnea, please bring your machine and mask or mouthguard with you. If you wear dentures or partials, you will need to remove them before going into surgery. Come to the hospital wearing your hearing aids. Before you are brought into the operating room, we will have them put with your belongings and they will be stored until your surgery is finished. Wear your glasses and keep any contact lenses at home. Do not wear any jewelry. Please remove any dark-colored nail polish, as we check your oxygen levels through monitors worn on either your fingers or toes. The morning after surgery, you will be asked to put on your own clothes. Please bring at least 2 sets of clean clothes with you. You will want to wear a lighter shirt for when you are exercising. You may feel warm. While resting in your hospital room, however, it is a good idea to have a sweater or sweatshirt. It is common to have some swelling in your legs and feet after surgery. Whether you choose to wear shorts or pants, it is recommended that they do not have a button or zipper. Ones with elastic or drawstrings will be more comfortable and easier to put on. If you are having knee surgery, please make sure the bottom of your pants are not tight. The team needs to be able to roll up your pant leg to look at your knee. It is very important to wear freshly washed clothing daily in the early weeks after surgery to reduce your risk of infection until the incision is healed. Sneakers are the ideal footwear, but you may choose to wear a different type of shoe. Your feet may be swollen, so bring your current sneakers rather than purchasing brand new ones. If you prefer other shoes, they should have a back to them. No slippers without backing or flip-flops. We also provide you with non-slip socks. For entertainment, each hospital room has a television, free Wi-Fi, and a tablet to be used during your hospital stay. You are also welcome to bring personal items such as books, a tablet, or phone. After your surgery, you will not be able to drive for several weeks. Your surgeon will inform you when you can drive again. You will want to make sure you have a ride to and from the hospital. If you are having surgery in the winter months, please make arrangements for snow removal if needed. Connecticut Orthopedic Institute at St. Vincent's Medical Center provides free valet parking. If you are unable to walk into the hospital, a wheelchair and transport will be provided. Please do not bring any walkers or canes unless you require them to walk in the facility. While here, we will provide you with the necessary equipment. Upon entering our Orthopedic Institute, you will be shown to our registration desk. Please bring your driver's license and insurance card so that we can verify your information. Your coach or family will be given the option of accepting a pager or providing us with a cell phone number. This way, they may be informed when you are out of surgery and when the surgeon is available to speak with them. Our staff will bring you to the waiting area until it is time to enter the preoperative department.